Today, I want to talk about a major and often overlooked clinical challenge. When we think about the elderly population, we think of cancer, heart disease, or dementia. But there is another issue that can instantly change someone's life: falls. Falls are a leading cause of injury and loss of independence, yet most approaches today are episodic and reactive. This creates an opportunity to shift towards a more proactive model, using continuous monitoring to identify risk earlier and prevent events. The Fall Risk Kit, or FRK, is designed to support that shift. It is an open source platform that connects devices, cloud systems, and medical records. The goal is to simplify adoption and enable earlier detection. Importantly, care settings are diverse. Beyond acute care, patients may be in assisted living, independent living, or community settings. By enabling continuous monitoring, we democratize access to data, creating a continuous heartbeat of insights between caregiver and patient. The work plan is structured across 3 phases: technical development, validation, and scaling, supported by a grant strategy. The detailed timeline is provided in the attached Gantt chart. Technical development focuses on building a modular, open source foundation. It connects devices, clinical systems, and data pipelines. The goal is a scalable, repeatable architecture that simplifies adoption. Cloud infrastructure is configured using infrastructure as code, automating deployment and ensuring consistency. Using EHR standards enables structured data capture that supports interoperability and health equity. It also supports social determinants of health and aligns with quality measures and value-based care. Validation and clinical integration ensure the system works in real-world environments. This includes pilot deployments, workflow integrations, and model evaluation. This phase ensures insights are clinically meaningful and safe. From there, the focus shifts to scaling. This includes expanding across organizations and enabling population-level insights across all phases. Grant strategy is critical. Initial funding supports development, expanded funding supports validation, sustained funding supports long-term scale. Equally important is governance. Privacy and security are built by design, using secure pipelines and clearly defined access controls. Clinical and social data introduce potential bias. This requires transparency in data, models, and decisions. And importantly, there's always a human in the loop supporting, not replacing, clinical decisions. From a leadership perspective, this work requires a situational approach. Leadership aligns to the work and the people. Technical development aligns to democratic or laissez-faire leadership. Policy and funding align to transformational leadership. Clinical integration align to structural leadership, balancing control and collaboration. Understanding team dynamics is also critical. Different objectives require a balance of personality types. Frameworks like Myers-Briggs helps illustrate these differences. From a personal standpoint, I tend to prioritize being right over being liked. This can help in problem solving, but can also impact collaboration. This reinforces the importance of building balanced teams. In closing, falls represent a very complex and growing challenge. The Fall Risk Kit moves us from reactive assessment to proactive prevention. Success depends on execution, governance, leadership, and strong teams. Ultimately, this is about building not just a platform, but a sustainable model for improving healthcare outcomes. Thank you.